How do I monitor my glucose levels? Glycated hemoglobin, or HbA1c, is a blood test that measures your average blood glucose levels over the preceding 3 months. In general, the recommended target level for HbA1c is less than 7%, since this is associated with reduced risk of long-term diabetes complications. However, HbA1c does not tell you what your glucose level is currently. To know your current blood glucose level, the most common method is through a finger prick to retrieve a capillary blood sample that is read on a glucometer. Another way of testing glucose levels is through a continuous glucose sensor. Once placed on the skin, the glucose sensor rests under the skin and provides a glucose reading every 5 to 15 minutes to produce continuous glucose curves. Once inserted, glucose readings are sent to a receiver, which is typically an app in a smartphone, and may be used for 7 to 14 days. These measure tissue glucose levels, which may not correspond exactly to blood glucose. Glucose levels fluctuate throughout the day. It is important to check your glucose levels before meals and at bedtime to guide insulin dosing. More insulin may be given to correct for above target glucose levels. This is in addition to the insulin to be given to cover the carbohydrates in a meal. In general, pre-meal glucose targets are 4 to 8 millimole per liter. Bedtime targets may be higher at 6 to 8 millimole per liter. If your bedtime glucose level is less than 6, you may want to consume a carbohydrate snack to reduce the risk of overnight hypoglycemia. Bedtime readings also allow you to correct for above target glucose levels. If your bedtime to fasting morning readings remain steady within 2 millimoles per liter, that would mean your basal insulin dose is adequate overnight. Post-meal readings show how much your blood glucose rises in response to your meal, and if you have given enough insulin for the amount of carbohydrates consumed. Your glucose will rise by 3 to 5 millimoles per liter after a meal, even with appropriate bolus insulin dose. Glucose rises for the first 2 hours before dropping for the next 2 hours, then stabilizing. If the reading 2 hours after a meal is more than 10 millimoles per liter, you may want to administer more insulin. Use a bolus calculator to account for active insulin given just 2 hours ago. Click here to watch the next video, Becoming an Expert Insulin User. And click here to watch the rest of the videos in our Type 1 Diabetes animation series.